Welcome back to Atlanta and Company, everyone. I'm Christine Pilara. The Neuropathy Treatment Centers of America offer state-of-the-art facilities for patients seeking an experience like no other clinical environment. The NTC's main focus is peripheral neuropathy, which could lead to conditions like restless leg syndrome. And here to tell us more are Dr. Matthew Doduro, Dr. Dan Martin, and Dr. Matt Dunn. Welcome to all of you.
Thank you.
Thank you for being here to shed some light on this condition. And let's talk first about NTC and how it was founded.
Well, Neuropathy Treatment Centers of America was founded by my brother Joe. He was over in Italy for about 11 years and got a master's in neurology. And while there, working with some of the top neurologists in Europe, he was able to bring back some of this technology. And so he's based out of in Arizona, and we are the Atlanta contingency. And we're really excited to bring this to our community.
So today we're discussing peripheral neuropathy. What is that?
All right. Well, the peripheral refers to the peripheral nerves, which is the nerves that come out from the spinal cord and go to the extremities. The neuropathy is any disease of the nervous system. So basically what we're dealing with is damage to the small nerves that go to the hands and the feet. Now, a lot of times folks are going to experience numbness, tingling, sometimes sharp pain, sometimes even burning in the hands and feet with this condition.
Wow. And Dr. Martin, who suffers from this?
Christine, that's a great question, and the answer is astounding. It's literally about 18 to close to 20 million people that suffer from peripheral neuropathy. Yeah, and amazing is that about 14 million of those actually are diabetic. So I mean, typically after 1 out of 2 diabetes patients actually might get peripheral neuropathy.
Why is that?
Well, typically they've seen because the blue cholesterol level gets out of control,
right,
and they don't control their diet, their lifestyle, and but the doctors earlier talked about how to manage that. That really helps. We've also seen in patients that actually have chronic lower back pain, pinched nerve from like a sciatica, from a herniated disc, stenosis, things like that. Carpal tunnel syndrome, things like that have also caused peripheral neuropathy.
And I see chemotherapy drugs.
Yeah, 1/3 of people who go through chemotherapy actually get peripheral neuropathy.
Oh, so that's just one of the unfortunate side effects
it is.
Then.
Yeah.
Well, Dr. Doduro, what are the current treatments then? What can we do to help people?
You know, right now they're really trying to manage the pain. There's no drug that actually cures the nerve problems. So what we're trying to do is more of a multi-therapy approach. We're helping awaken those nerves and helping open up those blood vessels so that they come back to life.
And how do you go about doing that? What's the typical treatment? What if I'm going into your office saying, "Help me, this is what I'm experiencing," what will you do?
Well, we're using low-level lasers, light lasers, and we're also using some state-of-the-art technology to actually test the different sensations to find out if there's large fiber nerves that are being affected or more of the small fiber nerves. Right now, the way doctors test for neuropathy, they use EMGs, and they're testing more of the large fibers. We're looking more to test these smaller fiber nerves that have been affected.
Okay. And Dr. Don, what's the goal or what's the mission of your office?
Well, a lot of the patients that we're seeing come in with this neuropathy, they've been to everyone, they've done everything, and nothing's worked.
Right.
So naturally they're frustrated, and they don't know where to turn or who to trust.
How painful to live with this condition day in and day out, and I'm sure it does lead to other problems, because if you're experiencing all this, who has the energy or who wants to exercise and take care of themselves because you're just in chronic pain?
Well, that's the thing, especially with the restless leg syndrome. People their sleep is disturbed up to 4 to 5 hours a night. They have to get up 3 or 4 times, and they're at their wits' end a lot of time.
And quite frankly, a lot of these folks have given up trying to even find a solution. And so what we've been doing is working with these people and working at restoring these nerves and ultimately trying to get them out of pain and get them back to the life that they deserve to have.
Great. And Dr. Martin, what should viewers do that are watching right now if they're suffering from this condition? You know, what's the answer?
Well, there's 2 things they can do. The first thing they can do, if there are people out there that might think they might have it, or they want to see if it's something that they might be having, they can go to our website, which is www.neuropathyofatlanta.com. and fill out a quick survey. It's a pre-qualifying survey. That information gets actually sent to us. We analyze this information. Within about 24 to 36 hours, we'll actually get back with the patients and communicate with them on this. The second thing they can do, if they know they have it and they're really excited about getting a cure, a fix for this, they can actually call our toll-free number, which is, I believe is on the screen there, is 888-452-4476.
All right, great. And you guys are being kind enough to offer a special for Atlanta and Company viewers, right?
We are.
Tell us about that.
After the show, for up to 2 hours, if they call within 2 hours, we'll actually give them a free exam and a consultation at our expense.
Wow, terrific. So if there's somebody who's maybe not sure, they're experiencing the symptoms, but they haven't been, clinically diagnosed, they can come to you guys. You can check them out and free of charge.
The great thing is they can get a baseline to find out where they are, and it's a progressive disease that only gets worse over time. So this will be good.
All right, thank you for being here. We really appreciate your time. Thank you for this great information. And if you would like some more information about the Neuropathy Treatment Centers of America, give them a call, as he said, at 888-452-4476.